Right, it's 3. We ready to get started with the recording and everything?
Yeah.
Okay, and I'll call this meeting to order. Oh, just a little bit early. A little early.
No, you're right on.
Oh, I got it on my.
2:30 a.m.
All right. So first item is the approval of the June 16th, 2022 Parkview Health Center committee minutes.
Move to approve. Second, Mr. Chairman.
All right, any adjustments?
I didn't see any.
Okay, then all in favor of approving the minutes, say aye.
Aye.
All opposed, say nay. Okay, motion carries. Item number 3, public forum. We'll see, do we have any members of the public here who would like to address the board?
Excuse me. Make note that we have one person missing from our group.
Okay.
There's only a 3-0. We have a quorum, but we only have a 3-0 vote on the minutes than anything else that comes up now. 4.
Yes.
Sorry.
Yep. Yes, that is correct. Mary Beth is not, Supervisor Gabbard is not here. Okay, is there anybody on Zoom that wants to address? Okay. Is there anybody on Zoom? Okay, all right. You can let me know if I need to, if that changes or we need to accommodate anything there. Otherwise, we'll close that and move on to the financial report. Doug, are you going to take the financial report?
Yes.
All right.
So, looking at the income statement that was sent out, through June, we should be around the 50% mark on all of our stuff. We're a little low on the revenues at 42%, and that's mostly due to the census being a little bit lower than what had been budgeted. But fairly similar to prior year. The expenses, same thing with the labor. We're running about 41% there, so down compared to what we had budgeted also, and even down lower than what we had last year. So with the census being lower, we're having lower labor costs right now. Travel category, most of the travel is always usually done in the springtime, so that's why that's a little bit higher. Capital, the big projects that have been done are the neighborhood flooring, and we finished up part of the door projects that was carried over from last year. We're waiting on finalization for the kitchen dishwasher. That's the $100,400. Waiting to work on that. Everything else pretty much looks in line with where it should be. See, our deficit at the end of June is $1,262,000. We applied $3,250,000 of fund balance this year, and that's the number that's at the bottom. If we would take that 250,000 and divide it by 2, that's the 1,600,000. So we're running about 362,000 better than what we had budgeted. That's pretty much what.
Questions on the financial report? Okay. Then we'll move on to administrators report.
Okay. Our current COVID-19 outbreak status, we have no positive residents at this time. Our last positive resident was on June 11th. Our last positive staff was actually on July 11th. So our outbreak currently goes through July 25th, pending no further positive cases. The monthly average census is at 113. That is increased from May, which we were averaging at 110. So far, or for June, we had 18 admissions. That increased from May, where we only had 3 due to outbreak, and 6 total discharges. Number of individuals on the waiting list is now at 11. That's down from 16. Pay sources are 16% are private pay or VA, 73% medical assistance, 3% medical advantage, and 4% traditional Medicare. For the staffing update, our current vacancies are, we have 37.6 open CNA FTE, 10.8 open nurse FTE, 1 open food nutrition service FTE, 2 housekeepers, 1 administrative coordinator, 1 social wellness manager, and 1 administrator. Survey updates, there are no updates in this category. We haven't had any recent survey activity. As far as project updates, the training center was just, or at the June 30th update, they anticipated the roof to be starting the week of the 4th, which it looks like that's on target. Also, the exterior masonry was supposed to be completed by the 8th, and the anticipated completion date is sometime in mid-October.
So what's on?
The trusses are on, and I'm not sure if they've got the sheeting on. I didn't notice the sheeting at all, but the trusses are up
What's in the work?
pretty soon. Yep. They started putting the trusses on Monday. I had them completed by almost the first day. So it went pretty quick.
So, for the month, for the census, or how many neighborhoods do we have closed now, or
2,
2, which is how many?
21 in each neighborhood.
And the openings, which are 47, almost 50 position openings, staffing, is that would, how am I say it? Are those 50 openings with what we have? How do I say it? 50 openings, or that 50 open, some of those are because we have 2 neighborhoods closed. I'm trying to say, are those 50 openings?
Related to the neighborhood closures?
Yeah,
or-
thank you, that's my.
No,
Okay,
and that is a barrier to us opening at least one of those neighborhoods at this point.
so you would need, if you get, okay, I know.
And the one of the 2 neighborhoods that is closed, we keep as the designated COVID neighborhood as long as we can. The federal regulations really want us to have that separate space. So right now that is what we're using one for.
Would you say that the number of beds, the waiting list, would have anything to do with the number of beds in the closed units? I mean, you've got a closed unit, you're not using those beds,
Right.
and you can't transfer people from one unit to another unit, so that those beds could be used.
So we transferred as many residents as we could to try to free up one of the current open neighborhoods to be more of the rehab neighborhood, which is what one of the 2 closed neighborhoods formerly was our short-term rehab people. So right now, really, the only barrier is the staff, in which we would need additional to take care of another neighborhood of residents.
So those 11 on the waiting list are.
Sometimes when she
Staff.
calls them, they're not quite ready and they wish to remain on the waiting list. Some are just on there for, looking into the future.
So if you do have a resident or a person who has COVID in that COVID section, how do you cover that for staff? So are you just covering that from the current
Yeah.
the current group of staff.
And we ask for volunteers and, you know, we try to do as many 12-hour shifts as possible to have the fewest amount of staff exposed and to pull the fewest amount of people off the floor. So we
So,
generally don't have a problem. People are there's a little bit of a pay incentive there, so they're usually pretty okay with working up there.
so, but if we do have persons with COVID, that adds that much more of a stress towards the stretch of the staffing as
Correct.
well.
Potentially.
Other questions? All right, then we'll move on to item number 6, information and discussion, budget submission, therapeutic wellness transition.
That's where we come in.
All right,
Yes. Good afternoon. Thanks for giving us this opportunity to speak to you this afternoon. My name is Tim Lauren. I'm the lead activity specialist at Parkview, and I've been with Parkview for 30 years.
Yep, and I'm Elizabeth Pupeter. I'm a board certified music therapist licensed with the state of Wisconsin, and I've been working at Parkview for the last 31 years.
So we're here today to hopefully provide you with some information, history, and insight into the department's request for the change in the table of organization and the wage level increase. So I guess I should say, why now? Well, the total years of service that are made up of the activity department is about 106 years. The success of our name change and the wage level increase really isn't going to affect Elizabeth and myself financially or professionally right now, but we want to set a precedent to the citizens of Winnebago County that you and all of us are committed to taking care of our own residents here with our quality of care at Parkview and our 5-star rating.
So in your handout there was the background and introduction. I'm not gonna read through the whole thing. I'm just gonna highlight a few items. And if you have any questions, please don't be afraid to ask. We'd be glad to share some more information, but we are unlike any other activity department, other nursing homes, because we are all degreed professionals utilizing our education to provide social, spiritual, physical, and emotional quality programming for our residents. So most nursing homes often have their CNAs do a lot of the activity programming, but you know, Parkview has set the precedent that we are all licensed and degreed staff. So moving on into that second paragraph, and due to that, we have been deficiency free in the activities area with our annual surveys for 30+ years. So I think that is indicative of the type of education and the quality that we bring to the programming that we offer at Parkview.
And to clarify the surveys, you know, every year we have the state and federal regulators from CMS and come through and survey and go from top to bottom through Parkview and grade and watch over everything. And part of the activity process is taking a sample of residents, about 10 to 12 residents every year, and putting them in a room with the surveyors, and the surveyors ask what if they like the activities, if they're happy with what type of recreational programs and psychosocial programs there are, and they've always been given very high regard to the services that our department provides. So
Also with that, in that second paragraph, thousands of dollars have been specifically donated to our department. We have been blessed by some very strong support from our families and just validating what we offer to the residents and providing quality of life and purpose to their lives while they're still at the nursing home.
yeah, a good example is Dr. William Weber, who was the medical director here at Parkview for many years. Upon his passing away, much of the money that was raised from his memorial service, the family wished to specifically go to the enrichment of the residents through the activity department, whether it's the Master Gardeners program or the Weber Garden Memorial area that we have located on the grounds. It really speaks volumes of how the Weber family and Dr. Weber felt about the activity department. I guess I can say another family has a loved one who's passed away now probably 3 or 4 years and continues to send us $1,000 just for the activity department to enrich the residents and their activities.
So that's really, we just are very thankful that the families can
Yeah.
participate and be a part of the programming that we offer. So in that third paragraph, our department is responsible for maintaining family and friend relationships that are strained due to restrictions placed by DHS and the CDC during the pandemic. And with that, when we were in the height of the pandemic, we were closed and families weren't allowed to come into our facility, and everything that our department promotes, social wellness and building community by bringing people together. When we were at the height of everything, all our residents had to stay in the rooms. And so our department really had to be quite creative and innovative in how we are going to be bringing our people together, how we're going to maintain those relationships with family that can't normally come in to see them. So we utilized the technology. We used iPads, we did social platforms, we did Zoom, we did window visits. And then even since residents couldn't come out of their room, they still needed to see those familiar faces by us staff. So we, in our great room, Tim and I came up with Parkview News. So we had our own newscast that we would broadcast out to our residents, telling them about what's going on. It was just a very tongue-in-cheek, lighthearted type of programming. We did music programs that we were brought to their room. So we really had to be quite creative in coming up with new programming. And we're going to talk a little bit, and on the agenda, there's a little bit more about the upgrade on the sound system. That's, where we struggled a little bit with some of the technology barriers that we were having at Parkview. So anything in that one?
Yeah.
Okay, and then in our last paragraph, there it says, and current county wages are not always indicative of the level of education. The county pays a non-degreed painter higher than our degreed department. RNs, medical social workers, clinical dietitians at Parkview are paid more, but have the same educational requirements as some in our department. The job description has always required an advanced degree for employment, which has not been reflected in our wages or job grade classification. So that kind of goes back to why we're going with the different name change. Therapeutic wellness sends out a different message than activities, going back to us all being decreed. And so the vision for our wellness department honors the individuality and the experiences and culture while enriching life's purpose through respect, dignity, and choice. So we as a department really are advocating for our residents and quality of life and promoting purposeful life until the very last stage. Does anybody have any questions or comments or anything that we could help pass along to you?
I think I have a question.
Sure.
And don't take the question in a way that I don't support what your position does. It's just that I'm gonna take the path that I'm still kind of the newer person to this. And just the oddities that I see. So right now, we're without an administrator. So in my head, I'm trying to process why we're talking about this position without an administrator. And that leads me to ask the question about where this conversation started in the process. And so can you just give a little history of when maybe the board or maybe leadership here at at Parkview made the decision to bring this down the pike?
Well, historically, when you go way back, when Winnebago County was unionized, Parkview employees were all union. The highway department was union. The sheriff's department was union. What happened is at Parkview, the number of CNAs nursing in the union was a larger body than the number of activity people. So when there was terms of negotiating contracts and trying to get our voice heard, there wasn't a whole lot of voice that we had. There wasn't a lot of wiggle room. It's the union at the time was very antiquated with, if the highway department got this, then Parkview got this. If the sheriff's department was negotiating it, then Parkview was negotiating it. So for years, we've been trying to bring it to the forefront, which again, she pointed out that the painter was getting more money than us. And so we kept moving forward, and as time developed with particularly the COVID, and we re-examined where we were going, we started a stop, start, continue program of what should we stop, what needs to change, and what should we continue. And this is where we kind of brought to the forefront again the name change, and we had a new administrator on board who was very eager to help us out with the steps of this process. And this is where we're at, where we kind of followed along with her guidance to meet you all here and give you the information and the background, and then moving forward with it. Okay. So, yeah.
When you itemize all of your various kind of classes, we'll call them, or anything from basket weaving to singing or dancing or whatever. When you think about that list, and when you think about how schools choose to eliminate certain programs, bring in certain programs, their curriculum, do you go through a curriculum change over time, or does that pretty much stay the same? And do you take the individuals that you are plugged in those programs, plugged into, do they change? And or do they gain a certain amount of experience and then are left after the transition of curriculum, left hanging somewhere so that they're not doing what they were paid to do, they're now doing something else? What I'm saying is many people, when they supervise large scale business and hire somebody in, though that person might have a degree or even a master's degree in something, they're not being hired for that particular purpose. They're hired for something else, say drafting, and they don't get paid what they would normally get paid at their degree. And they have to come through a training period. But then what I'm saying is that in some cases, the people that say they're degree and want to be paid as a degree person can't be paid as a degree person because they're not working in their degree given area. So what justifies, or honestly justifies, the increases in wages based on a degree that was gotten 5, 6, 10 years ago, and now that person may be traveling in a different training group? See what I'm saying?
I think I do. All of us, like for our department, we still do the job that we were hired for. We do the programming, and that programming does change based on health trends, interest, and new research that has been coming through in the therapeutic fields that we all represent. And the programming that we choose to do is based on resident interest. When a resident comes into our facility, we sit down and we have an interview with them, and we talk about their likes and preferences and how they prefer to spend their time. And so from that information, we develop the programming that we offer to the resident. And that varies from resident to resident. So we do offer programs on an individual basis, where some residents prefer maybe a smaller group or individual versus a large program down in our great room that some residents are more comfortable, which would be like our music service, church services, things of that nature. So it is based on the resident interest and need and reflective of current healthcare trends.
I think too, we definitely are trained and educated from our degree as to how to involve that resident at whatever level they're able to participate at. We may get somebody in who's got a very, very mild case of Alzheimer's, but it's going to be long-term. And as that person, the disease progresses, we are educated enough to apply the approaches and changes that need to be made to still allow that person to enjoy and have a success with the activities that they're interested in. I'll give you just a brief example of someone who likes to play cards. You like to play cribbage. You're a forgetful person, so you're gonna have a lot of assistance, verbal cues, and helping maybe a partner with your cribbage. As your disease progression, as you start to lose perhaps your vision from the dementia, the cards are gonna get a little bigger so you can see those numbers better. You may have to modify the cribbage game itself and change it to go fish. You may even have to go all the way down to somebody who's severely affected and always loved playing cards, but now you've got 2 decks of cards here and saying, hey, why don't you just sort these out for me by suits? So he's still enjoying cards at the level that he is. And that I gotta tell you is an important factor of the education process that we have gone through to be able to do that.
Sure, so, many times someone who is in these degree fields, that where they get their degree from, there is, continuing education that needs to take place every year throughout their time in order to maintain their degree and their certification as well, correct?
Correct.
So that means that there is consistent, along with your surveys of knowing and understanding what the needs are of residents, the continuing education components would follow that as well, correct?
Correct.
Yeah. So, and I think I just wanted to hear it confirmed that the continuing education elements, and the reason why I bring it up, and it relates to Mr. Cox's comments about understanding the degreed elements of how positions can change within this field, and how healthcare entities many times will pivot towards responding to those changes through the use of continuing education. So that way your degree remains relevant throughout your time of employment and still is consistent with the mission and vision of the organization. So that's, I guess that would be just my general comment related to that.
I just had one question on the budget impact sheet is, it looks like 1 in 3 are flipped. This is going to have higher labor costs, right?
Let's go the answer to that.
Yes, I believe that is switched around.
Okay. But the figures are probably right.
Yeah.
Okay.
Yeah.
Okay.
It's still a net cost on the bottom, it's just how it isn't a savings, it's a cost.
How many of these positions do we have now on staff?
Oh, in the activity department,
Yeah, how many do we have now?
we have 9 that work on the floor. Yep.
Yeah, and that's,
What is that in terms of, excuse me, what is that in terms of a ratio between people and staff?
One staff person per neighborhood with 1 float to cover when the person's on weekends or off.
You designate a neighborhood as being a particular illness or a particular, like dementia neighborhood over here.
It really varies. I mean, each neighborhood has its own flow, but I really can't categorize, and I'm sure Jessica can say that we really categorize by diagnosis. I think it's more of a level of care and how much the neighborhood as a whole can handle based off of cares and interesting personality characteristics that are attributed to some of our dementia residents. So
There is one neighborhood that's considered locked.
oh,
Consider it.
Locked. it's a lot.
Oh, a lot.
And we just changed the. So there's now.
Okay.
That neighborhood is met.
Okay, any other questions or comments about the therapeutic wellness transition? Thank you.
Thank
Thank you
you.
very much. Move on to item number 7, information and discussion, budget submission, RN quality assurance supervisor transition.
All right, so I'm talking on behalf of this. This is actually my current position, so I didn't really want to be the one to talk about this, but here we are. So just a little background, this position is looking for a name change to the Assistant Director of Nursing / Infection Preventionist. Right now, it is the Quality Assurance Manager and categorized with the other neighborhood supervisors. Prior to me taking this position was titled the Assistant Director of Nursing. And they eliminated that position and changed the name and then rehired someone into the position. So you can,
What is it now? What is it called?
the Quality Assurance Manager.
And what is it transitioning from? What,
The Quality Assurance Manager is what it is currently. It would be looking to change back to the Assistant Director of Nursing / Infection Preventionist. So in the new position request, it just gives a description of the duties, and then I can answer further questions, but I'll just briefly go over it. So this position manages all aspects of infection control, COVID currently being about 75% of my working day. With COVID and the regulations that are put forth by the government, by the CDC, I'm essentially on call 24 hours a day, 7 days a week, on vacation. It doesn't matter if there's an outbreak, I have to be involved. There's reporting requirements. I only have X amount of time once we learn of that positive case in which I have to report it. So again, if I'm on vacation, it doesn't really matter because I have to be the one that reports it to the federal government, to the facility staff, to the families, to public health. All of that has a time frame on which it has to be completed, and there's monetary penalties if that is not completed. In the past, this position wasn't really an on-call position. It would be an occasional call if we would have like an influenza outbreak, which we didn't have very often. So just really the level of availability of the person in this position has increased, as well as this position, because of the changes in COVID especially, we need to have a director of nursing or someone representing that role also present for state surveyors that are coming in more frequently with COVID related topics. If Ashley's off, I have to cover. I am overseeing all of the other managers, which are currently in the same pay grade as myself. So
How many different other managers you have? And I mean, my simple question, if we're using the title Assistant Director of Nursing / are there any other Assistant Director of Nursing / that we have?
no,
No, okay.
it would only be that one. There's currently 4 neighborhood managers that manage
Okay.
the other neighborhoods throughout the facility. So just an example of where this kind of has impacted and brought to light just the enhanced responsibility, availability. We had a huge outbreak at Parkview during the Christmas holiday. It hit us very hard. We were super short-staffed. I am on my way walking out the door with my kids to church on Christmas Eve. There was a positive staff and I couldn't go because I had to stop what I was doing, call the person, get them out of the facility, call the facility, move this resident. We need to do this, that, and the other thing. So it's just, you know, it's hard when you have to be tied to your computer all the time, you know, and it's a position I don't take lightly and I don't have a problem with it, but it's just the level of responsibility is more so than the other managers. Therefore, Ashley and Kara had discussed and wanted it moved up to a different bracket because of that level of responsibility.
So really the addition, the financial addition to this position is the 8,000.
Yep.
That's a new amount, and that's what makes the distinction between the title and the salary is that amount.
8,000.
8,300. Right. Thank you.
I was wondering if you could point out the changes to the job description outside of the sort of takes over
Mhm.
or fills in components, other pieces of that infection prevention piece that are expanded or
Correct.
responsibilities. Okay.
Sure, so with, formerly, a couple of years ago, when I took this position 8 years ago, it was minimal reporting, you had to do once monthly reporting, and that was really the extent of it, just kind of overseeing, are there any trends, are there enhanced infections in other areas? So really not as significant of an impact with infection control. The coverage, we didn't really have any concern there because, you know, we weren't in transition with administrators and we just had a more stable environment, so to speak. Currently, I have to report daily what our census is, how many staff are vaccinated. I have to keep track of all the staff vaccines. Have they declined? Is our process complete on the end of HR, on the end of Parkview? And that stuff has to be reported daily. And if you don't, like I said, you have to meet certain benchmarks or it's citable.
And then the corollary to that is, are there responsibilities of the current position that are not in the new position?
No.
Okay. Thank you.
So have you been compensating any extra in these last 2.5 difficult years that we had a pandemic? Because what you just told me or us is that, I mean, you could be on vacation and some breakout, they're calling you up. You were on your way to church, they're calling you up. Has you been eligible or we've been eligible to keep you compensate you somehow for all that extra responsibility, also stress of doing that extra work?
To this point, no. The only thing that I have done is flexed my time and taken some time off and down the road when things calm down, if I'm able to. But other than that, no different compensation.
I'm just shocked. I mean, I know we've done small things with the health department because they've been stressed and a lot of work pandemic. I would think I would have supported something especially for you. I mean, like what you told me, especially the last 2.5 years, it's still ongoing. And you know, what you're telling me, yeah, I'm not opposed to this change either, but yeah, I mean, I think it's something to say. That's, boy, responsibility to, you're the one, and yeah, I don't know if we are compensating you properly, and I think we should be thankful that you're still here, because I think there'd be many people who would have been burnt out or whatever in the last 2.5 years. Yeah.
It was a little rough.
Any other comments, questions?
My only question, Mr. Chairman, these two new requests, change, when would they be coming either to us to vote on or the board to vote on? I'm just curious about that. Maybe Doug's going to answer that question.
These are gonna be added into the 2023 budget.
Okay, so if I'm understanding what you're saying, Doug, I kind of process that the county executive will either agree or not to agree to them. And you can give us an update next month when you have your meeting, because I think I'm agreeing with that. Thank you for that.
We'll move on to item number 8, information and discussion, budget submission, our care resident call light system upgrade.
Okay, so for this, this is one thing that we're gonna request in as one of our add-on items. Right now, we're dealing with the nurses and CNAs, nurses on the different wings. They're running into the problem where we're running with not enough actual phones that will notify the staff that a call light has been pressed. What this will do is we're asking for 100 R-Care phones. They're rugged, built with a molded case right on them. Supposedly indestructible, hoping that they are. They do look very nice. And with 100 phones, that will give us 10 in each neighborhood, so that 5 can be used on the shift, 5 can be getting charged. And when the new shift comes in, the previous shift's phones will be plugged in, new phones will be going out. That way we'll have enough phones on each neighborhood that will always be able to answer the call lights. Right now, sometimes a shift will come in, they'll pull a phone off, it'll only have like a 10% charge because it's just got plugged in to get charged. So that's what this is. The phone or the system that they're using only allows for an Android 5 or lower phone to be used. This upgrade will actually allow for a nicer or more current level of phone service and a little more options there. And then also with that, they will take our server that houses this system, upgrade the hard drives on it so that they're not the disk hard drives, they're HDDs. That will allow them to last longer and process better. So then that's what this is about.
What kind of battery and battery charging equipment do you have with this?
It's just a standalone pod that has 5 cables coming out, and you plug all the phones in.
What kind of rechargeable battery do you have?
It's a lithium,
Just a lithium,
just like all of them.
Can you get replacement batteries?
These are all new phones, pretty much are built-in batteries.
They're built-in batteries.
We have some that actually are old enough that actually have replaceable batteries. Currently, not too many of those. Even the new ones that we're buying for $60 a phone are all built-in batteries. You can't get a rechargeable or replacement battery, hardly anymore.
So it's a matter of replacing the phone if the battery goes.
Yeah, which the phones, if they don't get broken, they last pretty long. I mean, we have some phones that have been here for probably 7-8 years and work okay. But
What is the cost of one phone?
one phone is $434. That's why the top one is the 100 phones for $43,000. For the 100 phones replacement.
Yeah.
Just curious, when an emergency light or system is engaged, what does it say on the phone?
It shows the room and where it would, which call button was pressed.
Okay.
It will actually tell you that. The nice thing about the phones is you can contact other nurses through the phone. They're locked down to just be pretty much contact with other nurses or show the call lights. That's,
So who, being curious, who manages the, how is the management of that data? Like who handles that? You know, like, so if that changes internally, is that managed within Parkview Health Center?
which, well, I guess it depends on what part of the data.
Sure.
I actually add people into the Arctur system myself. And right now I'm programming the telephones to make sure that they're locked down, along with Megan Shader, staff coordinator. So we're kind of splitting that since Tom left.
Okay.
Because he used to do all of that himself.
Oh.
So the financial person was doing the IT. And the reason he ended up doing that is because otherwise, if you get a new phone in, put it in her office, send it down to the IT department, and then they program it and send it back. It's 3 days later.
Sure.
I can program a phone in 15 minutes.
Okay.
That's why.
I mean, I asked about that because I wanted to know if there was an efficiency, and it doesn't necessarily sound like it's fully an efficiency, but it's done in-house.
It's done in-house.
Okay.
These new phones are fully programmed when we get them. We don't have to program the blocking app or anything like that. They're fully programmed, ready to go.
Do you see any problems with loss or with misuse or with training people to use them properly?
No, they actually, and what we're projecting here with 100 phones, we actually will have 4 phones in the training facility so that they can be using them to train the new CNEs coming on to how to use the phones properly. Like I said, all they do is see the call lines. That's all you can do on it. That's it. You can't go out to the website. You can't get on the internet. You can't
Toilet
get
or
on-
anything,
Yep.
make a mess out of them.
Yep, no,
Like
it's,
that. You don't have to
they're-
get them to leave a security card or their driver's license so that they can
Nope.
take it out.
nope. And if you take it, you can't use it for anything because it's locked.
Yeah.
So. And they're right now pretty cheap phones.
Any other questions?
This interfaces with your current
Yes, it'd just be an upgrade.
light system.
Yep, yeah.
So,
It would just be an upgrade to the newer software version and with the newer phones. Yeah, if we would go out and try to rebid the whole nurse call system with all the wire routing, I think the last time we did that was in 2017, and it was close to $300,000 to just rewire the whole.
how do you like the price on this?
Actually, it's not, I mean, the phones are, I mean, the majority of the price, the actual software upgrade, and the system works good, as it is. We have other phones that cost similar. We got a phone that's designated for our in-ship supervisor that she carries everywhere. It has to be an IP phone that she can transfer phone numbers. That one right now, to replace that one phone is $600. So all in all, and these are, he brought in a sample when he came to drop off the bid or the quote. And it was a nice, solid, heavy duty phone.
What kind of cost is involved if should they come along with another upgrade? Or they, after they've upgraded it one time and then they say, oh, well.
As long as, I mean, we haven't upgraded since 2017. And the upgrade portion of it only is probably 12,000. I mean, yeah. The actual neighborhood council, that's just a spare, just in case one goes. We have a council in each neighborhood. We just had to replace one just probably about 2 months ago, a month and a half ago or so. That was $3,500. Their TV screen and sometimes you just go out. But so we thought we'd get an extra one as a spare, just to have one. And so the upgrade part is only, and that's the server upgrade, which we probably wouldn't have to do the full server upgrade, along with the actual software upgrade is the $12,000. So I would say the upgrade would be minimum 6,000-7,000 maybe every couple of years, 3-4 years.
Well, 300,000 every.
Yes.
A lot of the, a lot of the different departments have upgraded their video securities and whatever to the tune of about 30,000 from last year's budget. And I can see where this would, be something you need to
This
keep current.
is something that the nurses have
Yeah. No,
mentioned a lot.
I'd be willing to vote for it. So, that's where I'm at.
And so you do it or internally, and you don't have, the IS department doesn't get involved much or at all?
Right when I started, they were involved a little bit, so I could learn how to do it. Tom showed me some stuff, but then something weird comes up. But yeah, now it's me and Megan. We have a sheet on how to program it. We can actually do it. Troubleshoot if anything goes wrong. A lot of times what we're running into is they run the battery so low that it loses our Wi-Fi signal. So then you have to just reset the Wi-Fi password and then it works fine again, once it's charged. So, and that would be eliminated by having enough phones.
Does it have something on it that tells you what level the battery is now drifting to?
Yeah, it will, it has a little battery icon.
Yeah.
You can tell, but nurses need the phones and,
Not enough backups to be able to sufficiently charge it.
no,
It's a good diversion for you.
yeah, yes, it is.
I don't know about these phones, but I know mine, after about a year or two of charging it, using it all day and charging it again, the battery has taken a beating, so.
Yeah.
I can't imagine how you get 5-6 years out of them. They must be some kind of super batteries or, so.
The one thing too is like with like my phone, if my battery's performance starts to decline within a certain period,
Mhm.
I don't like doing it because it's a pain in the butt, but I can call the insurance company that I pay for,
Mhm.
to get a new phone and everything. So is there anything like that, like any type of warranty or anything that's related?
I don't think, I don't know that there's anything specifically on a warranty on battery life.
Sure. Yeah, and a lot of times when you start using them in a more professional setting or, they tend to do away with that stuff because they realize that there's money to be made
Yeah,
in the brand new replacement.
and a lot of times these phones, 12, 14 hours a day, they're used.
Yeah.
Continually.
So 5 years is a good time, to get out of a phone.
Here's another question for you. What happens if you leave them plugged in indefinitely because you have only a few RNs using them on one particular area? You don't rotate them. If you don't
Yeah.
rotate them, they stay plugged in.
Yeah,
then what happens to the battery?
well, usually,
Overload.
Yeah,
for
we-
too long.
they're usually never that problem right now.
Number of these, do you have a?
Yeah,
you
they're
have them
all,
numbers
they're
that
actually,
You can rotate them by
Yeah.
number.
well, they're all being, right now, they're all being used on the neighborhoods.
Yeah.
And they're complaining they don't have enough. Just got a call that one of the neighborhoods this morning was down to 2. So we had to scramble around to scratch up 2 more for them so that they could make it through the day. But we'll be in, because we get them sitting in our mail slot. This phone isn't working, this phone isn't working. So we have to figure out what the problem is, or just recharge it and make sure that we can log in and send them back out.
Anything else about the phones? We will go to item number 9, information discussion, budget submission, resident-centered media upgrade.
So this one is another one of our requests for the add-on. We had put it in the budget last year, and the county executive had pulled it out because he was going to put it into a countywide media upgrade project. And that nothing really has happened on that yet, so. And it really is to a point we are running into issues where residents are having problems. Now that they have the smart TV, we have one channel that's designated for residents. If the activities want to expound on this, because they are deal with it a whole lot more than I do.
Originally, our televisions were purchased by the Oshkosh Community Foundation, and they were all analog televisions. So as we switched over to the smart technology, we have a channel 15 that shows the great room programs for people that cannot come to the large group activity. If they want to watch church, watch a music program, our speaker series, they just turn on channel 15 on their television in their room. What's happening now is those televisions are older and we've replaced them with smart technology. In the great room, when we first moved in, it's an analog system. And so the television, now the smart television is not, it's too smart for the analog. It won't, when you do a channel search, it won't pick up the analog channel. So even if you have the channel 15 engaged and the analog is on and you do the channel search at that time, it won't come through. We experienced a lot of system components that in the great room right now, we actually have 2 kind of sound systems. The United Way and the Green Bay Packer Foundation, like 7 years later, upgraded our Epson projector and also put in a few surround sound speakers. So we actually have 2 different sound systems right now currently in the great room that aren't compatible. So it's making it difficult to try and do channel 15 programs. We have a screen, we have 2 LED non-movable cameras to be able to try and have residents watch a program from the great room. So in some instances, whatever type of program, they're watching a camera from a camera to their television. So it's a very poor representation of what program is going on in the great room, where we actually tout that, oh, you know, you can come to Parkview and still go to church because you can watch it on TV, but we got programs that are just not happening. So
Can't be
that,
So last year they went through the IS department, got the full quote on upgrading the system so it all meshes with the newer TVs. And this is the cost from last year's. So I know IT is working and updating the pricing, but we wanted to put something in there so you had an idea of what it was going to be.
So this is not true pricing.
No,
Saying,
no, they're working on getting that updated.
So you would use this to broadcast, am I correct?
Yes.
So, and I mean, I'm pretty interested in this, and, you know, I mean, my colleagues probably don't like, you know, when I made the proposal to have meeting broadcast and recorded, you know, we had to find different systems. One reason why we have this owl is to do that. And along the way, I found out that, well, the sheriff's department has a camera set up. The airport or the aviation has one, and the room next door. Now, maybe those are too basic, but possibly this great room, yeah, I think this equipment, whatever we need, would help the residents, but it could be possibly used for other means. And I think that's where the value is, I think, and I think that's what I'm hearing, you know, you have a camera. I think it is value. I hope, you know, and I know the county executive, and I hear when you're saying, Doug, oh, we need a room, it costs $60,000 to $80,000. I don't know if we really need that. Maybe a little more, but if it's going to do a dual purpose, it's primarily for the residents' activities and that, but also we can find other uses. Fine, we should pursue it, and that's what I'm hearing. And like I say, I know big deals, camera angles, and you know, you only have one camera angle, and if the speaker, or have a program where you have the speaker moving around, that's difficult. I guess that's the one beauty of this owl, is that it moves with whoever's talking, and you can program to just follow that speaker. So, yeah, I'm interested, and I understand it's not true pricing, but yeah, we'll be considered, because I don't know his ideal of having a quote unquote media room for the county is going to happen anytime soon.
I think, you know, the underlying engineering of all of the equipment, the people that really know what they're doing, and step back a ways and take a look at, you know, the dollar amounts and the design before, you know, getting fully wrapped up in exactly what we have here, because that's going to change. Part of it's going to change. If this is old design,
Well, it's from last year.
from last year, old design, you know, you've got new stuff out there. You have just in moving pictures from one system to another system, you've got a television has a certain renewal of the picture as you see it. And the first in front of you the first time around. But if you're doing this through several types of, you're going to have that renewal 2 or 3 times, and it's going to get a flicker when you get to the other end, you know, where somebody is taking a look at it. I'm pretty sure that happens. So I think what you want to do is get a designer that knows the electronics,
That's
knows how to set it up.
Excel Engineering is who actually put the
Yes,
proposal together last year.
and get
And-
real
and
numbers
they-
out there.
And then that's where we got, and they're going back to him to see if that stuff is still, pricing is still.
Yeah, so you need the real numbers.
Oh,
here.
This is, this will be,
hypothetical.
this will be for the budget for next year. This is the add-on. So,
Do you think that,
oh yeah, they'll have it probably by mid. They were figuring probably this week, if not next week, they should have it.
I don't have any comments related to the project or so to say, other than, I think that updated quote that you're gonna be soliciting, might be a useful resource to ask outwardly in the community for contributions related to that. I think that this is something that we talked about the foundation originally covering the TVs. I think if they were informed that their contribution of TVs had, that you had moved on from that you had invested in the system, and that you're now needing to invest in a system again that will be supportive to the needs, therapeutic wellness of the needs as well of the student, of the residents. I think that there may be a couple organizations that provide dollars related to this that would contribute to this. So it's out of my thing, but I do this a lot anyway. I can make a conversation about it and engage if someone, if there would be entities that would be interested in that.
There's roughly $1,300 that was granted from the Oshkosh Community Foundation and Oshkosh United Way.
Yeah.
We started with an Epson projector, and then the XL came along with the console. And so Kathy Glander went back to these organizations and said, can we utilize this towards the upgrade? So there is 1,300 in the coffers towards the upgrade of this, but yeah.
So I just think there's an opportunity there that we could get some outside dollars to come in.
I agree.
Yeah.
So just telling the right story.
Even grant funding or something.
Sure.
Yeah.
So when we hire the administrative assistant, fill that position, that's part of what that position does. It goes out and solicits donations.
Okay.
Anything else about the media upgrade?
So I have one question. So if I'm hearing this correctly, this is a platform that you use to enrich the lives of residents as well, and it's not, over the last couple of years, it hasn't been a satisfactory doing that.
Our Parkview News, we did kind of a on-site interview, like I'd go down in the kitchen and show them, cooking with Josh, and then I'd go to the roof to show them the solar panels with an iPad. Well, the only way for the residents to see it was I had to send that interview then through an email, which IS then got mad at me because it was too much space, and then send it back to the device that was down in the great room. The whole thing kind of is gonna be allow us to stream as well, which the trends and the medical trends of people that are coming into the nursing homes, one of the amenities they want is to be able to stream with their smart technology. Nobody's coming in anymore without their smartphone or their tablet. They're bringing their own Roku stick in, so they want that when they're gonna become, it's just an investment alone just for the future, for the residents, not only to use for themselves but for also us to integrate it into programming.
Sure. Just in general, what percentage of residents do you think benefit from this technology?
Oh, all of them.
In the sense that it provides them a connection, every resident can be connected through this system.
What we want to do also is to provide music through the television, through that streaming system, which will definitely benefit people in the ends of life stage that maybe want to have some relaxing music, spiritual music playing in their room, or the exact opposite, some other kind of specific music that they're interested in. You look at the yourself and myself and how much television is an important part of your leisure time. You go back another 30 years where people perhaps didn't have television yet and it wasn't a big part of their life, but how important it is.
Yeah, go ahead.
Yeah, the streaming alone, like I said, has really changed the face of television watching.
My hope is that someday I get to be in a nursing home, well, not necessarily. But then if I do get put in a nursing home, then you'll be able to stream rap music into my room.
That's right.
So,
That's right. I know. Yeah.
Have you thought about maybe making videos? And, we now have a YouTube channel, right? Access to a YouTube channel,
Yeah.
and we could put either general things about Parkview and or if you thought there was a significant event and you said, hey, let's, tape it, record it and put it on a YouTube channel, we could do that. That's one thing that we haven't done. I mean, we could do.
Yeah, we interviewed, non-resident staff, and so residents got to meet, Jessica, or they got to meet the new administrator, they got to meet some of the maintenance men. We went out, the residents weren't allowed to go outside. So we actually, from spring until early summer, did videos of how nature was growing in the spring, so the residents had access to it. So it worked out real nice.
We could have Parkview own YouTube channel.
Right.
I'm not saying you have to have that, but we could have that.
Yeah,
I think one or two videos would be encouraged to put on the YouTube channel for people at their leisure. And before we leave totally top, well, we different topic, but not about this, but other on there.
Better numbers.
Oh, yeah.
Current numbers.
Yep.
and Current information, what they would really give you.
Yeah.
So.
Oh, yeah. Yeah. I know IS is working with them to get that.
Yeah. So I think, I think the reason why I inquired so much about how it relates to your roles and how that relates back to the residents is that we started off our meeting talking about what your role is and what the impact of that is. And I'm a really big proponent of making sure that our staff have what they need to be able to do their jobs. So now everyone's job is different, right? So, but your job is specific to enhancing the quality of life of residents through several different mediums. And I call them mediums because they really are. So it takes unique and creative and innovative people to be able to do what you do. So, and I think the use of technology, modern technology, is absolutely imperative to that. I'm very jealous. I worked in the housing industry for 10 years in low-income housing for the Housing Authority. And I advocated for this type of system to be implemented because I wanted to engage our residents more on their level other than my level. And I think that's what's really important about the use of technology is that it gets us to their level.
Along with that, during COVID, we really expanded our use of the iPads, and it is a great tool for our seniors to expand their knowledge, and to teach them how to use an iPad. And, it was wonderful because then they could do video calls with their families. So once again, we're engaging them and bringing them together, but also we're teaching something new to them, something that's current. And prior to COVID, we did some partnering with Oshkosh North, their communities program, and they would come out and teach our seniors how to use technology. I mean, so it's really neat that there's some intergenerational programming that goes on, but also this is what's going on. And as Tim said, our current residents that are coming in are expecting, this is what they're used to. And to say, sorry, we don't have that. It's hard. And those are one of those areas that we could really easily improve upon.
Now, this is a capital request, correct? Or is this an operational request?
Kind of. It depends on, it's a system that's gonna be put in place, so we could request it as capital, yes. Each specific item probably doesn't get to the 5,000 range, but the whole project itself, if we're putting that in, it would be, could be put in as a capital.
Okay, thank you.
Well, these are add-on stuff, so this doesn't go in. These are add-on things that we would like to have that he has to approve, that John would have to approve to get put into the budget. That's limited to what we can ask for this year. levy limit.
Well, this isn't a security system.
Nope.
This is.
This is.
It's probably why
program.
it got lost, is because there were so many security systems going on. Probably didn't think they wanted to go in that direction.
I know, if you don't mind, we have at least two people there. A couple questions quickly. Is there gonna be returns? I think the event called, is it called the Fall Festival? Remember that, you know, at least, United had, you know, it's obviously used to be every, is it October or September? That, I thought maybe with, obviously it's probably called off or postponed because of COVID. Is it gonna be planned again?
We actually kind of started to make a change towards something that was more hands-on engagement. We're still kind of navigating the post-COVID within regards to our activities. Right now, CMS just has us having families still only visit in their rooms. They're allowed to visit outside. So what we're trying to do throughout this summer is explore these options of allowing family and events to meet outside. We had a few weeks ago, or about a month ago, some baby goats that came and visited Parkview. We're looking at trying to get the TNT band out here in August for a family outdoor band event. But what we're kind of really seeing too is residents wanting to engage more on a more personal level. So we're doing a lot of activities right on our patios, where the residents just go outside from their neighborhood instead of going all the way outside. You saw the number of staff positions that are unable to fill. And it takes a lot of people to get people out front from that certain area. There's a lot of logistics involved.
So you kind of answered, my next question I'm gonna answer or ask, but, you know, have you ever thought, I know I tried to get one of the past directors, I'm also on the Parks Committee, about, you know, utilizing somehow, there's a gateway between, you know, where the Parkview property ends and the park starts, and I have always thought that there's a way we can get Parkview residents at least somehow to enjoy the park somehow. And I know, I'm trying to think, what's they have at Bella Vista, and they have, I can't,
The trio
between
bikes?
what?
Are you talking about bikes?
The bicycle, I can't, and I thought, and Larry Launchflatter knew about it, and I said, why do we bring them out here? And I thought there was some preliminary talk about having, so my basic question is, have you thought about somehow incorporating the parks, the park is right next door into, you just probably answered one of my, part of the question, it's a challenge to get a lot of people out there, but maybe a few people at times to use the park somehow.
Yeah.
We actually do utilize
Okay.
the park already. We have some bikes that are called the trio bikes. It's a program called Cycling Without Age, where,
That's what I thought.
Yeah.
yes, they have, it's almost like a tri-shop where
Right,
they sit in the front and then we as peddlers take them out. So we utilize County Park. We take them on, we have an actual little route that we take them through so they can enjoy the dog park, the ponds with the
Well,
fishing. So we do utilize that.
I'm very glad, because
Mhm.
one of the past directors was not too keen on that, and I'm glad the other directors were a little more open to it. I'm glad about that.
We got some hardy residents that go in late October. We put sweatshirts on, we got blankets for the bikes, and yeah, it's a lot of fun. So anytime you want to come and get a bike ride, we'll take you around, really. They're a lot of fun. Or we'll teach you how to be a pilot.
And we'll probably learn more if we have it.
Can we just make sure we're bringing it back to the agenda about the media upgrade?
Okay.
Your questions about
Sure,
that?
go ahead.
Okay. All right, any other questions about the media upgrade? All right, then I'm gonna move us on to item 10, discussion related to suggested topics, future educational plans for the Parkview Ancillary building. Supervisor Cox, I think this is something you suggested. I don't know if you had something you wanted to bring up this time, or if you wanted to just kind of keep this on the back burner for when, for a future date.
Well, since we have these people in here, and they're interested in providing various classes for the people that you have in the system here. I understood the ancillary building was going to be a training, a building for training RNs and nurses and people on the staff. But because of the size of the building and because the building can be reused when the staff isn't in there, it would seem to me be a good place to make an effort to develop some sort of classes, whether they're music classes or whether they're basket weaving classes or whatever, for the people, the patients and the seniors and whatever that you can get together. I don't know how the administration would want to look at that as being separate and unique for the. You're not going to be in there 100% of the time. You know, you'll be in there for certain class lengths, whatever it is to train. And then there'll be given periods of time, just as a school donates time for the gym to be used, or a school donates time for, you know, classes for first aid or whatever else. You can write off a certain amount of that building to use or utilize in outside activities that come from the patients or come from, you know, a local area. You know, you might have first aid classes in there for some reason or other. Or you might have, you know, a meeting of Boy Scouts or something, whatever. But you can develop educational plans from within, from the administrators and from the people that actually work with the patients. And it would seem to me that there would be a way to work that out. So that's where I'm coming from.
All right. Item 11, do we have any suggested future topics?
When do you have your budget meeting with the county executive?
Oh, so my calendar.
Because I would like to see if we do a little in-depth, or leave it agenda, maybe not in-depth about the budget and that, and hopefully it'll be after you meet with them. On April.
Talking about the county exec's budget.
Yeah, if each department, committee and department head has their own separate meeting, and I was just trying to run.
You would have your budget meeting for Parkview separate from any discussion with the exec. He would not be in on the Parkview budget.
Sure. He is, yeah.
Would he be in?
Maybe doing that is what they did. August 17th is me for the park, so I don't know.
Yeah,
It's the 23rd of August.
Oh, so.
yeah.
I guess I can make it an agenda item, but, it would be better for the after you had you kind of, but maybe you were planning on doing that anyway.
Yeah, we can make sure that, I mean, I think this may get into the next, when we have our next meeting, but I think our calendar would have it slated for August 18th, just prior to that. So I think we could either, I guess I'm not as familiar with the process as probably some of the others here, but and probably either talk on the 18th about what will be discussed in that meeting, or it may be more informative to talk at the September meeting about what came out of that meeting. But I don't know if we have the right group of people to know that right now. I don't know what your experience tells us, but certainly make that whatever options available to this committee.
Wouldn't know how far along by, say, the 18th you'd be with regard to your budget here.
Budget is kind of pretty well put together right now.
Yeah.
But it has to be tweaked.
And to have
A few
the,
dollars.
to have the exec come in and sit in or work with,
Oh, no, we don't.
you don't.
We don't work with them
No.
at all
The-
until the date of the meeting. Then we present what we're requesting to him.
Right,
He makes his decision on what he wants to allow or what he wants to change at that point.
so you'd like help from the committee here to, view of your budget setup. You'd like the help from the committee to oversee that and say, okay, yeah, that sounds good, and that sounds good, whatever, so that
Well,
you have that.
we need more help after he makes his adjustments to, if he pulls something out to bring stuff back into the budget for the actual, when the county board actually deliberates on the budget. That's where we need the most support.
Just a minute, Mike. His executive budget is gonna be formed during the week of the 21st to the 27th.
That's what we have our meetings with.
Right. So it may be after that we have, may want to
Yeah.
plan early in this month of September rather than wait until after the board meeting. So I'm getting that.
Okay. What is the action at the board meeting that you think?
Well, the board meeting, our board meeting is going to be on the 20th of September. Okay.
But that won't
Yeah.
impact anything on the budget.
No, it won't. But see, what we've been trying to do is get them to their board meetings just before, or put our committee meeting just before the board meeting, so that they have an opportunity to bring forward anything.
Yeah, we wanted our committee meetings to be ahead of, with at least a week notice for the P and F committee.
Yeah.
Right.
So that we weren't holding over for 6-8 weeks. But I think it sounds like in September, we want to do a more in-depth review of our committee fund, or of the Parkview budget.
For what I would like to know, I mean, obviously, we can't discuss it now, Doug, is, his edict, the county executive, is we have a 0% increase. And some people believe it's a 4% decrease because of, that's what I would like to know.
Mhm.
I don't want to discuss it now.
Yep.
I don't accept your prayer, but I would like to know what, since the 18th is close to the date you're going to have with the county executive, I would like to know that preliminary, and then
Yeah.
who knows what he's going to cut. So that's why I'm asking that again, the agenda next month. Thank you.
So can I ask just clarification to that? So just so that my mind is processing what I think you're asking, is that, are you asking the staff or leadership of Parkview Health Center to provide us their projected budget before it would be presented to the county executive?
If you can do that,
Okay.
yeah, because like I say, I'm asking
Yeah.
One committee, any committee I'm on.
By the time we have that, if we have it on the 18th, that'll be close enough where our budget will be pretty well finalized by that point.
I see value.
We move in, then we move into the following week and you'd be meeting with the executive. And we would,
I see value in seeing what that budget looks like before another set of eyes is put on that, because then we get to see another picture after that's taken place, and gives us a little bit more information of what the county executive is looking
Well,
for.
and
versus what we're-
you will actually see in the budget, the schedules are department request,
Okay, yeah,
executive
got it.
executive changes or executive budget. So any changes between those two is pretty much what he did.
Okay,
We'll hold that item next, both in August and September then to provide updates on where we are.
considering that the 18th is going to be our next meeting.
Yeah, does that work for everybody?
Everybody,
The only one that it doesn't work for is Ashley is on vacation. But I'm thinking it's gonna be more about budget anyway, so.
Everybody did a great job of stepping up and pitching today anyway, so to make it work one more month. All right.
This is not an agenda item, but what is the status of the search for a new administrator? Anyone, I mean, I guess I'm asking Doug, I mean, you probably know more than anyone.
I thought they were gonna have
Someone toured yesterday.
second, a tour for one of the candidates one of the top two candidates had a tour yesterday.
So
I wasn't available, but they did take the person around and. So, the top two candidates that they selected were, they thought were very good. So either one will be.
Anybody have anything else? I'll make a motion to adjourn.
move to adjourn.
second, Mr. Chairman.
All right, all in favor, say aye.
Aye.
All opposed? Motion carries. Thanks, everybody.
So do you remember